Good evening, everyone. I'm Kelly Wright. Welcome to tonight's program. Hey, I hope you enjoyed a great weekend. And here we are facing yet another week, and we're still battling coronavirus. This virus has not gone anywhere. It's still out there, so we must be careful and take care of each other. And that leads me to my opening observations. As you know, many states have reopened, some 12 to be exact, and perhaps a few more coming online. As they do so, the question looms large. Is it too soon to reopen, especially when there are no answers? Now, I get it. Everybody wants to get back to work. Everybody wants to try to find a new normal that might be quite abnormal. But the question is, can we do it and still safeguard our lives? And those are my opening observations. Now let's get right into it because we've got a jam-packed show with some very important information to talk about. We're going to talk about genocide. We're going to talk about health disparities and break that down. So we've got a lot to talk about. Let's get right to it. My first guest on the program tonight is Dr. Benjamin Chavis. He is the president and CEO of NNPA, Black Press USA, also a good friend of not only the show, but me personally. Doc, it's good to see you.
Thank you. Good afternoon. It's good to see you, and greetings to all of the viewers at the Black News Channel. And I'm always pleased to be on the Kelly Wright Show.
Well, I'm always pleased to have you. We are good friends, and it's kind of hard when we can't see each other. So this is our way of not just socially distancing ourselves, but actually giving you a virtual hug, my brother.
Right. It's a virtual reality. Thank you.
Okay. Well, we've got some serious issues to talk about, as we often have on this program. And you have brought something to light that you had talked to me about a couple of weeks ago, and your team has been doing some studies on this, and perhaps you should share some light on that, and the fact that what we're seeing in the world right now as it relates to this pandemic's effect on African Americans might lead to not only racism, but also genocide. Explain that.
Well, thank you very much. Since the pandemic, at least for the last 6 weeks, the National Newspaper Publishers Association, we've been covering this issue. We were the first to issue the warning there was a state of emergency in Black America. We saw this trend happening very early, where African Americans were being disproportionately not only infected, but disproportionately dying as a result of infection by the coronavirus. Yes, it's a novel coronavirus, but one of the things that's not novel is the disproportionate impact on Black people. It's systematic, it's institutionalized. And I went back to 1948 when the United Nations established the Convention on Genocide. And the reason why the United Nations made these definitions, this is back in 1948, was to prevent governments or societies from targeting certain groups, not only for disparities, but racial harm or racial destruction, racial elimination. And certainly, if you look at what has happened to African Americans over the last 6 weeks and across the country, this is just not one state or one region. We are the top, they refer to it as comorbidity, but actually we're the top fatalities. Now in New York City, it's Blacks and Hispanics about together, but the point is, I just want to read to you this definition from the United Nations 1948 Convention on Genocide. It says, in the present convention, genocide means any one of the following acts committed with the intent to destroy in whole or in part the national, ethnic, or racial or religious group, killing members of the group, causing serious bodily harm or mental harm to members of the group. Remember, stress is one of the things that makes you susceptible to this virus. Deliberately inflicting on the group's conditions of life calculated to bring about its physical destruction, in part or in whole. Again, we are disproportionately exposed to environmental hazards. We're disproportionately exposed to housing discrimination, where we don't have good air, good water, good food deserts. All these things are not by accident, Kelly. And so what I'm saying, and what I released this weekend on a tweet, actually, and we're going to do a story this week, so I'm breaking some more news. I believe what the evidence shows that racism plus health disparities with respect to African Americans amounts to the United Nations definition of genocide.
I'm talking to Dr. Benjamin Chavis, who is the president and CEO of the NNPA, the Black Press USA. We'll be back with more of the Kelly Wright Show right after this. Welcome back to the program. I'm talking to my good friend, Dr. Benjamin Chavis, who is the president and CEO of the NNPA, Black Press USA. And Doc, you've been really in the forefront. For example, your organization declared a state of emergency for Black America as related to this COVID-19 pandemic. You created a coronavirus task force so that we can keep an eye on how we deal with this crisis within the African American community. Not that you were negating the fact that it can hit anybody, because this virus is no respecter of titles or persons or places, or for that matter, people, but it has impacted adversely and disproportionately in the African American community. And now you're stating, based on 1948 UN statistics about genocide, that we could be facing some genocidal, not tendencies, but actions. And so let's drill down on that a little bit more to remind the people what you're concerned about.
Yes, I'm concerned that Black Americans in particular have been targeted for racial profiling, have been targeted for health disparities, have been targeted for housing discrimination, have been targeted for environmental racism, have been targeted for getting the least concern when an outbreak happens, like the COVID-19. And I think all of these things together not only paint a picture of a pattern, of a systemization, of an institutionalization of the racial impact of this, but it causes death. And when it causes death in disproportionate numbers, one has to ask, is this by a natural circumstance? Is this by nature? Or is this by man-made racial prejudice, deliberate acts that lead to the death and destruction of a particular racial group, which is what the United Nations has defined as genocide? And I'm saying now, in 2020, we must not allow these acts of genocide to go unchallenged, go undefined, and we must also plan now how to prevent this from happening. We have to deal with the harm that's already been done, Kelly. Mm-hmm. But we are working with the National Medical Association, those are all the Black doctors, National Association of Black Nurses, and other Black professionals. We have very competent and experienced people. You know, Dr. Hilliard, who's the president of the Meharry College of Medicine in Nashville, Tennessee, is one of the leading experts in infectious diseases. And he's talked about how we have to deal with not just the data, but how to prevent this from happening. Same thing with Dr. Ebony Hilton. Okay. I want to make sure you get her on your show. She's great. She's at the University of Virginia, and she's a young millennial doctor who's out there fighting to try to warn us, first, of these dangers, and secondly, to try to make sure that we work to prevent these things from occurring. Now that some states are trying to open up, I caution Black Americans, don't let your guard down. Keep washing your hands. Keep social distancing. This this pandemic is not over with. It is still growing. While they said the curve has been flattening in some areas, in Black America, the curve is not flattening. Right. In Black America, the curve is still going up. We still have the highest fatalities, whether it's on the West Coast, the East Coast, the Southeast, or the Midwest, or the North. All parts of all regions, we have been disproportionately affected. And that's what's leading me to the conclusion that this may very well be the evidence of genocide.
Are you also disturbed by people that you see taking to the streets to protest, stating that they want their jobs back, they want to get back to work? We all want to get back to work. We
Well,
all
we
want
all want to
to
get back to work, but we want to get back to work safe.
right,
We want to get back to work. I don't want to return to the old normal. When people say, well, we're going to a new normal. Well, the old normal was abnormal. And
right,
we don't want to go to a new abnormal. We want to go to a situation where there will not be these racial disparities in health delivery. There will not be these racial disparities in environmental exposure to toxics. We need a situation where we will not go back to the abnormality of redlining and housing discrimination, where people are ghettoized in certain communities. I don't want to go back to a situation where our communities have food deserts, where we can't get proper food, fresh air, good water, clean water, and good food. So all of these things together, it's just not one thing that we're learning, Kelly. It's the combination of all these factors render a very serious, life-threatening situation to Black people and to other people of color. And we need to talk about it. We need to debate about it. We don't need to be just witnesses, bystanders to
right.
our own destruction.
Dr. Benjamin Chavis, thank you as always for being a guest on the program and always bringing information that is first and foremost truth, illuminated, and secondly, giving us the marching orders or the call of alarm so that we can actually keep sounding that alarm, keep shining some light on these dark areas so that we can actually expose it and then do our part in changing it. So I appreciate you so much for bringing that. We look forward to your series of stories that will be coming out in NNPA, Black Press USA, and of course, you're always welcome here on the program.
All right, thank you very much. Keep up the good work, Kelly. Appreciate you. God bless.
That's brother. God bless you. We'll be back with more of the show right after this. Joining me now on the Kelly Wright Show is Dr. Ricky Keys. He is quite a man who's been able to develop a great study. You're looking at as I'm sharing it with you, COVID-19 impact, addressing the uneven effect on African Americans. As many of you know, I've been talking about the disproportionality of this COVID-19 pandemic as it relates and adversely impacts the African American community. Dr. Keys, thank you for being on the program today. Tell us about the nature of your study, because you did this before COVID-19 came out.
Yeah, and I really appreciate the opportunity, Kelly. It's really a pleasure to be with you. One of the challenges that I've seen in the past is that there are communities that are disproportionately affected by things like, heart disease and cancer, stroke, diabetes, asthma, other pulmonary diseases, just a cross-section of conditions. Actually, I started doing this work with an organization that I founded in the past. It's called the National Institute to Combat Health Disparities. And NICHD was specifically focused on identifying and finding ways to address the disparities that existed. We went through basically looking at all of the communities throughout the country, looking at states, looking at county level data, and we wanted to find out what were the disparities themselves. Ultimately, we wanted to look at the underlying causes or the epidemiology of why these conditions existed. What were the root causes for why a person has a higher rate of cancer, for example, or stroke or heart disease, or any of the other conditions that we're talking about. So that was one of the things that we felt was critically important, was that we, number one, asked three questions. Where are we now? What do we want to be? And how do we get there? So the primary focus initially was, where are we now? And that's what I've been doing thus far.
So your study, what can we glean from that? And not only glean from it, but what can we do to apply practical applications to change this dynamic of disproportionality within the African American community to put us on a level playing field?
Yeah, what I've been saying recently is that there are pre-existing conditions that pre-existed the condition. So COVID-19 or coronavirus is the condition itself. But there are factors that cause African Americans in particular to have a disproportionate rate of, not necessarily contraction, because everyone has the equal ability to be affected by this condition. But the morbidity and the mortality rate for African Americans is significantly higher because of the things that you just cited, specifically hypertension. I recently saw a study that in the state of Louisiana, where I'm from, 58% of the people who died from COVID-19, 58% had hypertension. So if you look at the people who are disproportionately affected by hypertension, those are African Americans. And some of the other conditions that led to the condition, they have heart disease, some have cancer, pulmonary disease is a big one. So, but 58% of the people who died from COVID-19 have hypertension. The study that I did said that, okay, that's the condition that led to the mortality rate for African Americans being disproportionately higher than other communities. But the condition that led to those conditions include food deserts. It includes pharmacy deserts. It includes a lack of activity. It includes a number of underlying factors that contribute to those conditions themselves. And what I did in this study is I looked at, for example, the city of New Orleans, again, where I'm from, and I wanted to see where some of those environmental conditions led to these conditions. So, for example, I looked at the number of pharmacies by zip code, basically, and then juxtapose that to the percentage of African Americans. And as it would be obvious, there are a smaller number of pharmacies, grocery stores, primary care facilities, hospitals, all those resources that are desperately needed in our community, not only to combat this condition, but to prevent it from even happening before it even took place. There are significant disparities in the actual allocation, if you will, of resources in those communities. So, 70115, which is a zip code that I know well, that zip code has a smaller number of primary care facilities. It has a smaller number of hospitals. People have to travel longer distances to actually get to those places. In addition, they don't have grocery stores. The only grocery stores that are the only places that they could actually have get access to food are typically, convenience stores.
I'm talking to Dr. Ricky Keys, who's put together a very compelling study about the disparities within the African American community. Doc, I'd like you to stay with me, because on the other side of the break, I'd like to also address what we can do to start changing these disparities as they are currently happening. And let's talk about that on the other side of the break. We'll be back with more of Dr. Ricky Keys and his COVID-19 impact study addressing the uneven effect on African Americans. And we're telling you the reasons why these disparities exist. Now we want to talk to you coming back after this break. Welcome back to the program. So I've been talking to Dr. Ricky Keys, who has compiled a study, and it's very extensive. And for anyone who needs to get a hold of it, you should. It's entitled COVID-19 Impact, Addressing the Uneven Effect on African Americans. Dr. Keys, this is quite a study, and it's very eye-opening. On this program, we've been talking about the disparities that exist anyway. And then when the COVID-19 pandemic was looming larger, we started addressing that. We started sounding the alarm. And now that we're here in this new normal, as I've mentioned before, is quite abnormal, what can we do during this crisis and beyond the crisis to change these disparities? Because as we've heard Dr. Anthony Fauci say a couple of weeks ago, this disparity within the African-American community and even the Latino community pre-existed before coronavirus, as you've talked about in your study. And it's here during the coronavirus study. And then beyond the coronavirus crisis, we still, he says, will have these disparities. So Doc, what can we do to start changing this?
Yeah, so obviously when I spoke about NICHD, one of the things that we were focused on is where are we now? So what this study was trying to do was to identify the conditions that led to the conditions that we currently face. Where do we want to be? That's where we start looking at trying to resolve this situation. One of the problems that I have is that people have a desire to identify the problem and shout and scream about the problem, but they don't have a resolution for the problem. So the second question and the third question are the ones that we really need to address. Where are we now? Where do we want to be? And then how do we get there? So what do we want to be? Obviously, we want parity. We don't want certain communities to die disproportionately from any condition, let alone a global pandemic. But then let's ask this fundamental question, how do we get there? I believe that there are a number of things that we can do. Obviously, we need to resource our communities. We worked with the National Black Caucus of State Legislatures, where President Gilda Cobb-Hunter is the president of that organization. And we developed a resolution that specifically focused on identifying the lack of resources in specific communities with the eye toward addressing the disparities in income and health and, just spiritual, just all areas of what we try to term a new form or new-founded way of identifying health. We believe that the World Health Organization's definition of health is probably the best definition, and that is not just simply the absence of disease or condition or those kinds of things, but the spiritual health, the physical health, the emotional health, the financial health, just all these things wrapped into one. That is what really is health. So our objective is to identify those things, number one, but then to resource our community. And this doesn't have to be an altruistic or a nonprofit-based or any of those types of initiatives. This could be a money-making, profit-oriented approach. It could be public, private, just nonprofit, just a number of organizations coming together to actually address this situation. And I believe that that's the approach that will ultimately win out. One of the perfect examples is the tax bill that was recently passed had a provision that specifically focused on opportunity zones. Right. And if you mirror the opportunity zones with African-American communities and the contraction or the number of cases of COVID-19, you'll see that there is a direct correlation between those factors. Mm. So my hope is if we're talking about a private sector initiative, then let's bring organizations into those communities and actually have investments so that not only are they being addressed in terms of the conditions, but also the financial situations being addressed. Just any number of things that we feel are in desperate need to be addressed. So it's public sector, it's private sector, it's nonprofit, it's just a holistic approach to addressing the situation.
Well, I appreciate you for coming on. And before I let you go, I know you're starting another program that's actually part of this COVID-19 impact. Can you tell us about that? I know it hasn't officially gone on line yet, but we'd like to know about it so we can get in touch with you and look for you.
Sure. The organization, the nonprofit that I founded before, it's called the National Institute to Combat Health Disparities. And again, this is an organization that I founded 15, almost 20 years ago. What I have failed to do, and it's my responsibility, is I need to update the website and actually make sure that all the data that we're putting together is on the website. And one more thing, that this website and all the resources that I will have will be available on that website. So I have, for every zip code in the United States, I have data showing the availability of specific resources. And then I have the ability to juxtapose that with the racial, the race of that zip code, the racial makeup of that zip code, the income of that zip code, just almost every demographic characteristic of those zip codes, so that we could have a clear picture of where we are. because the problem is that we've not used data appropriately. We've not, used mapping appropriately. We've not had the information that we needed to make the appropriate decisions that we need to make.
I appreciate you so much, man. Thank you for being on. Please come back, keep us updated, keep us informed, as well as keep us inspired about what we have to do. Dr. Ricky Keys.
Thank you, Kelly.
Author of COVID-19 Impact, Addressing the Uneven Effect on African Americans. Thank you, sir.
Thank you.
Okay, God bless you. And we'll be back with more of the show after this. Welcome back to the show. So look, I like to smile a lot, and you can usually tell when I'm smiling, I'm about to bring something very good and joyful and celebratory, even in the midst of these dark times we find ourselves living with in terms of facing this COVID-19 pandemic. But the couple I'm about to introduce you to will shed some light into your soul, right down into your very soul. And that's George and Tondra Gregory. They are NFL chaplains of the NFL team, the Los Angeles, I was going to say the Los Angeles Lakers, but it's the Los Angeles Chargers.
Right. Well, at least you didn't say
we're talking about NFL. Sorry about that, George and Tondra. Welcome to the program.
No, I was going to say, Kelly, it's good to be here, but at least you didn't say San Diego Chargers. That's where we moved from. So we'll give you that.
Yeah.
Okay.
We're glad to be here. Thank you for having us. We're so excited.
Yes.
Well, look, I'm delighted to have you, and I should let people know that this segment that we're doing now will probably be in perpetuity because with all the things that we're faced with, I was thinking and praying that we really need to do something that strengthens the family. And that's what we're calling this, strengthening the family. Because while we can talk about all these lives that matter, it's really important that the family matters most. Because what happens in our home affects the nation. So George and Tondra, you've been working with so many NFL teams. Tell us what you've been doing to strengthen the marriages of players and the families of players, and then beyond that.
Yeah, well, being an NFL chaplain, most people think we only deal with players, but we actually do players, we do coaches and their families. So everything I do with the guys, my wife does with the wives, and we do it with our front office staff. So we're full service chaplains. And what we really try to do is not just to minister to one part, but the whole part. So we do a lot of these Zoom calls. We do a significant amount of one-on-one meetings. We do, Bible studies or encouraging calls. We're on 24 hours a day almost to what they need. We came out of the church world, so we know what that means. As most pastors feel your interview here today would understand. We're no longer in the church world. We happen to be in the marketplace called the NFL.
Tondra, one of the main reasons why I wanted you on, both of you, is the fact that we are, let's look beyond the NFL. We just saw the NFL draft last week. It gave us a good, pleasurable diversion to think about sports again. But let's drill down on what this COVID-19 pandemic is doing to the family. I recall mentioning to you once before, the COVID-19 pandemic is large, it's disruptive, it can destroy life, and it also has already destroyed life the way we know it, in that it's disrupted us. And of course, we know that it's adversely impacted African-American families because of the health disparities and other disparities that exist within our communities. Tell me from your perspective as a wife, as a mother, how we can strengthen the families that are going through these tough times where mom and dad may not know where their next meal is coming from due to unemployment, where a single parent may not know what she's going to do to raise her children in the face of this COVID-19 pandemic and the results of the economic disruption that she or he might have experienced.
Yes. So my encouragement is that we are better together, right? Mm-hmm. We're all in this together. You're not alone. Reach out for help if you need help. You don't have to suffer in silence. This is tough for everyone. Sometimes when we go through life struggles, we think no one can understand what we're going through, or we think we're the only ones, and it's a lonely place. But the thing about this virus, it's impacting the whole world.
Mhm.
So we're not alone. There are people who understand what you're going through, who are facing similar stresses that you're going through. So a big part is just knowing that we're in this together. You don't have to suffer alone. Reach out for help. There's resources. There's plenty of things that people want to do to help help us all get through this season.
Yeah, one of the things that to use a football analogy, this is the long game. This is not about the here and now. This is about the impact and the effects that this virus is going to have on not only just the medical, but the economic, or the schools, or just stability at large. And so we try to push people back enough for them to see that the perspective is not about what you're currently going through, but it's about the long game. So you have hope. There are resources. Some people are falling apart because they think they're very much alone, isolated in their individual homes. There's so many people. If we could get on these Zoom calls more and more, I think a lot of people would understand that they're not the only ones dealing with this. But there is hope. There is hope, Kelly.
Yes.
I love that. I'd like you guys to stay with me for the next segment as well. I'm talking to George and Tondra Gregory, NFL chaplains to the Los Angeles Chargers. And they've been doing some significant and impactful work, not only in the NFL, but also with people's lives around the world. We want to talk more about what we can do while we are kept under quarantine, or if we're kept under a lockdown in our states, and how we can maneuver through this tough time and actually strengthen our families. Coming back with more of the Kelly Wright Show right after this. Welcome back to the program. So I'm talking to two lovely people, a dynamic couple that's doing some great things in the world. They are George and Tondra Gregory, and as I've mentioned before, they are chaplains to the NFL's team, the Los Angeles Chargers, and they are living in an area that they see through sports what just the challenge of sports and being successful can do to a family. And we've been talking about what the COVID-19 pandemic can do to families. George and Tondra, I'm just so grateful that you're here. Let's talk about the fact that there are some families that are fraying at the seams because of the tension, the high anxiety, and the stress that they're experiencing because of the disruption of COVID-19. How can husbands and wives, or even people living alone or single parents, deal with the stress to alleviate the stress and deal with life in this new normal that's quite abnormal?
Yeah. Yeah. So, well, that's the key word, is stress management. Like, our stress level has intensified greatly because we were just thrown into something that we didn't prepare for. And then we were already behind the ball. I was going to say behind the 8 ball, but managing stress is going to be key. So you have to do those things that help you decompress. You have to carve out time to take care of your mental and your emotional self. Like, parents were thrown into becoming a homeschool teacher. I feel like that's a calling. You can't just become a teacher just like that. And then it blurs the lines between teaching your child and just being their parent, because now you have to wear two roles with that. So making sure, one, that you don't put too much pressure on yourself. You just have to do the best that you can. And you have to take that time to say, let me just end the day early, go for a walk, take a long shower, whatever it takes to bring your stress level down, which will help you live to fight another day. And another thing is just having what we call, even in using a sports term, would be like just that mental toughness. that we are going to get through this. This is not going to last forever. Stress and anxiety is brought on by this sense of helplessness and that I'm out of control. But if you can know that this will end, we will get through this, and we have what it takes to rebuild at the end of all this, right? So it's not going to take us out.
Yeah, another thing, Kelly, that is that we tell a lot of parents, whether they're single parents or whether they're two parents in the household, or maybe they're not in the same household trying to parent, is that you have to leave room in your day, not only for you to do mental health breaks, but you've got to allow yourself. There's so many moms that don't allow themselves to let their guards down, or to say to the kids, hey, you know what, I don't have it all together today, so I need for you to go to your room and you can manage yourself for maybe an hour or so. No, we're talking about older kids, but we as parents, we don't have to do every single thing. We teach the word grace. Just grace. We tell them. I had one young gentleman that called me the other day. He was in tears because he was not doing such a good job with teaching this kid as now a distance learning teacher. He called himself more the warden. And I told him, I said, listen, it's grace. It's not about everything that you can do. Do what you can, but learn to not put everything on your shoulders.
Fantastic advice from both of you. I see why you're out there on the front lines to help families, because families do matter. Again, I'm talking to my guests, George and Tondra Gregory, chaplains to the NFL team, the Los Angeles Chargers. They're good to have you. It's good that you could be a part of us. Pastor Rick Warren there at Saddleback Church must be very happy to have you as well. I'm elated that you're in this program to actually help us strengthen the family. And they'll be back on Wednesday. So make sure you start telling everybody to watch for this amazing couple that's going to really help us strengthen our families, because we need healing in our families, just like we need healing from this COVID-19 pandemic. And I thank you both for helping me issue this challenge that we can stand up together and kneel together in prayer. So thank you both.
Sure.
Yes.
Yeah, looking forward to being back.
Thank you so much for having us. We'll see you on Wednesday.
All right. Yes, we will, God willing. So thank you very much, and we'll be back with more of the Kelly Wright Show right after this. Welcome back to the program. So just a moment ago, we were talking about the family and strengthening the family. One of the best ways you can strengthen the family is to make sure that they've got some good food on the table. And the two ladies that I'm about to introduce to you have all the right sauce because they're boss, and that's Deborah Sandler and her daughter, Kia. Thanks for being on the program.
Thank you. We're happy to be here.
Oh, I'm delighted. Tell me about your company, because you're really taking off, even in the midst of this COVID-19 pandemic. And a lot of people are at home eating, and I always love good sauces, and you specialize in that and so much more.
Yes. So our company is called Mavis Foods, and our brand is Bazodi. We are from Venezuela and Trinidad. Mavis is my aunt Mavis, who's not with us today. She is quarantining at home in Long Island. And Kia and I are here in New Jersey. These are my aunt's recipes, and she has been cooking. She has been that favorite family chef. She has been cooking for the family since she was, an adolescent. And we decided about 2.5 years ago, we commercialized starting using her pepper sauces and her marinade. And we are about to launch a curry and tamarind sauce next week.
You're making me hungry.
Yes. And Bazodi is, so our family is from Venezuela and from Trinidad. And Bazodi is a Trinidad word that means head over heels in love. And especially at this time, we believe that any love that we can put into the world is so much better. And we always say, when you cook with Basil D, people will be head over heels in love for your food.
Well, we certainly need that. So these are some great suggestions that you're making about how can we get your product so that we can start cooking at home, because I'm anxious to try it myself, the Basil D, so I can be head over heels in love with my own cooking and my wife's cooking. She cooks very good. I don't.
Well, what's exciting about sauces too is they're kind of already ready to use, so you don't have to do anything really with them. You're welcome to always add them, and we're always welcome and accepting video submissions and new recipes that people come up to use our sauces. But they're easy to use, so even if you're like kind of a novice cooker, like I really was when I was in school, they're really great sauces to kind of just throw in with some meat or some fish. Just kind of.
But again, I want to thank you both for being on the show and sharing this. Hopefully you'll be getting a lot of response from those who watch this show, because at home, it's always good to spend some time cooking. And if we can freshen up the meal, I'm just delighted you got all these great ingredients in the food, and you're bringing that Trinidadian and Venezuelan, merging it together. I just can't wait to try it. Thank you.
Well, thank you. And we did cook up some Basil D Silka wings for you, drumsticks for you. Sorry you can't enjoy them.
You just had to do that, right?
And we'll send you some sauce.
Raymond must have told you that wings was my favorite.
Yes, yes.
I love you both. I can't wait till we get together, because I'm going to try some of those wings in person with you. Deborah and Kia, thank you. And look, seriously though, I'm praying for Mavis. I wish her well, and Aunt Mavis, keep doing all these great things that you're doing. And let's get through this together, and let's teach everybody to love food and to be head over heels in love with Basil D. God bless you both.
Thank you.
So much.
Okay. We'll be back with more of the Kelly Wright Show after this. Welcome back to the program. And now for my final word. First, I want to thank all of the guests who appeared on today's program. They spent some valuable time to enlighten us, to inform us, and to inspire us. Let's keep in mind what George and Tandra have talked about in terms of lifting up our families and strengthening our families. And finally, we hope that you've been ignited to be united, to keep spreading not fear, but love, freedom, and peace within your family, and for that matter, the family of man. We'll leave you now with Love Train. Peace out. God bless.
It feels so good, y'all. I'm inviting you. Come ride with me. You're all invited. All aboard. Let's spread some love. Love, 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 love. All aboard. Feels mighty, mighty good, y'all. Don't it? Everyone's invited. We're all united on the love train. Get on board. All creeds and colors, my sisters and brothers, get on board on the love train. Woo-hoo! Yeah. Yeah. It's all right.